First off, I have to do this. I'm taking your guys' picture, share with the rest of my sicko family. We take pictures of everywhere we go and speak, and just to show that people actually watched that movie. Well, how many people have seen the movie? Wow. Awesome. So, you know, we were not actors. We weren't paid to be in the movie. We're real people with real stories. And, you know, it's been an amazing journey the last 2 years since the movie's come out. I've gotten to go to some really cool places. New York City, first time I ever went was last year. It was because of the movie. And I wish I wasn't because of the movie, though. I've battled cancer twice now. I've beaten cancer twice, I should say. Both times I have been left financially ruined. Whether it was because of my age with insurance, or because I spent 2 days in the hospital with no insurance, we have to take the profit out of health care. I am angry at these politicians in D.C. get their health care handed to them on a silver platter, courtesy of our tax dollars. I want the same high-quality health care for me, my family, and every single American. Over the past 15 years, I've watched the healthcare system get worse. Since I was 12 years old, I've been watching this system get worse. The costs go up while the quality goes down. At the age of 22, I was diagnosed with cervical cancer. My doctor rushed me into surgery. Weeks later, I got a denial letter from Blue Cross Blue Shield. They said the type of surgery I had was only recommended on women that are 26 years of age and older. And so I was 22, they were denying payment to the hospital for my surgery. A couple weeks later after that, I got a nice bill for $8,000 that I had to pay. It's in collections. Now I'm 27, uninsured, and just battled cancer again. Only now I'm over $20,000 in debt so far. I am now cancer-free but financially ruined. Back in February, I spent 2 days in the emergency room, well, hospital. It felt like the emergency room, so I didn't actually get a bed until 22 hours later because I didn't have insurance. I was diagnosed with ovarian cancer. I had to make an appointment, or actually get on a waiting list to make an appointment to see a financial counselor to go about to finance my surgery that they were going to have to perform to remove the ovaries. A few weeks after I had my diagnosis, I went to the first presidential health care forum in Dearborn. That was back in March. After the CEO of Blue Cross Blue Shield stood there in front of me and said that we're nonprofit. We don't make a profit at Blue Cross Blue Shield of Michigan. I grabbed the microphone and I asked him, really? Then why did you deny me back in 2004 when I had cervical cancer? He just cowardly sat back down, didn't answer me, and I went in to tell the rest of the story. I told them how I had no insurance and I was just diagnosed with ovarian cancer and I'm trying to find a way to pay for it. Luckily, the kind folks at the Henry Ford Hospital stepped up and took care of me and got rid of my cancer. But it shouldn't have to take me standing in front of a room of strangers crying that I don't have insurance and I don't have a way to pay for life-saving surgery. It shouldn't have taken that. This system should have been fixed a long time ago. It's gone way too long. So, where does this end? I want every single one of you to do me one favor. Write a letter to your congressman and tell them that enough is enough. We have to support a public option because I believe a public option will lead to single payer. I would love to turn it on at 8 o'clock and Obama would just be like, well, I'm going to pass single payer. That's my fantasy, but it's not, in reality, it's not going to happen. but a public option will lead us to single payer. I strongly believe that. Now, we heard Dr. Michener talk about the Canadian system. I have used the Canadian system. You've seen Sicko, you've seen me take my daughter across the Ambassador Bridge into Windsor, and she used to go see a doctor over there when we didn't have insurance. Was it illegal? We won't go there. And let's just say they didn't like it very much. But I'm a mother, I have a sick child who's running a fever. What do I do when I can't take her to the emergency room and rack up an enormous bill? I can't get her in to see the doctor because we have no insurance. I had a friend said, hey, I'll see if we can get her over here, and it worked. I have no problems, no wait lines. Anytime I take her over for an ear infection, she was seen within 20 minutes by a physician at a walk-in clinic in Windsor, Ontario. Now, I've been to a hospital in Toronto. I went to an emergency room after being stung by a bee, and it's like the most glorious sight you'd ever want to see in downtown Toronto. They have a place called Hospital Row. And it's just a whole block filled with hospitals. And you can walk into any of them. And I was freaking out. I got stung by a bee, didn't have an EpiPen, and I'm going, all right, they're going to take and want to see my insurance card, and the insurance isn't going to pay for it. Didn't have to do that. I went in, within 15 minutes, I was getting a shot of Benadryl, and they were treating me for my bee sting. And the best thing, they sent me home with an extra EpiPen. Wow, those things are $100, you know. I have insurance, you know, and it was $100 for one of those things. But the myths about Canada, they're not true. They're myths, that's what they are. So, I like to try to, when I do these two, I like to try to interact. So, does anybody else, I know we're supposed to hold our questions, but does anyone else have a quick horror story with insurance? Real quick? No quick ones? They're all long, aren't they? And I always like to update everybody too on my friend Kyle, who you saw in the movie. He's out west in Calgary, Alberta. He's doing some iron working out there. Unfortunately, Windsor's economy has kind of fallen with Michigan's economy. And he was unemployed for probably a year, and he finally said, you know, I got to go out west. And west is where he's at now, so he's doing well out there. So, and nobody has anything.
Well, Adrian, could you just do more to give Michael Moore's credit? Like you said, real people were in that movie, and like that insurance guy there, used to be insurance guy, Bill Moyer, saying how they plan to discredit him, and some people believe it.
Yes.
But more to give Michael credit and that whole...
Give Michael more credit. He deserves all the credit. I mean, I was one of those emails that you see in the movie. I was sitting in my apartment in Boston, getting ready to move back to Michigan because of the healthcare out there, the mass health that they require you, they mandate you to buy insurance and hand your money over to those greedy insurance companies. We decided to leave Massachusetts and come back to Michigan. And my brother called me up and he said, Adrian, you gotta check out Michael Moore's website. Go on there, we're out on healthcare horror stories. And I'm like, they don't want mine. I'm like, mine's boring, you know. 2 months later, a film crew's knocking on my door. I wrote an 8-page email just going on and on about, you know, seeing it when I was 12 years old. I was taken to the emergency room because my inhaler wasn't working at school, so the school called, you know, 911, and I got an ambulance ride to the hospital, and my dad said, well, they're not going to pay for the ambulance ride, and they're probably not going to pay for the emergency room visit because we're under a new contract. My parents are GM retirees, UAW members. So I used to have really good health insurance growing up as a kid. I remember paying $3 a prescription, $5 co-pays for the doctor's visits, and then as we got older, I started seeing my parents, you know, sweat over going to the doctors. They were like, well, we don't really have to go. I mean, it's just probably a cold, you know. It's gonna be $25 for the doctor's visit, who knows if they're gonna cover the, the insurance is gonna cover the medicine. I've seen this starting out very young, and I think that's what has motivated me to come out and share my story. I mean, it's already been shown to millions of people around the world, so, it's sickening to see this happen in this country. And just to see that it happen, and people are they're losing their jobs, they're losing their health insurance. I don't know anybody in my circle of friends that can say they love their employer-based health insurance when they don't have a job, right? With everything that I've been through, with the two battles with cancer, I also live with MS, multiple sclerosis. I've been deemed uninsurable. So with that, I figure this is appropriate since I'm uninsurable for life. That makes me a sick one. Thank you.